Hi everyone, my name is Mike Hernandez. I'm going to be discussing the overview of autism spectrum disorder. What is autism? Autism spectrum disorder is a neurodevelopmental disorder. What I mean by neurodevelopmental disorder is that this is a disorder that impairs the overall growth and development of the brain or central nervous system. This affects brain functions such as emotion, ability to learn, self-control, and memory. This affects the overall ability the child has in order to communicate and interact with others. Autism spectrum disorder, or ASD, according to the American Psychiatric Association Diagnosis and Statistical Manual of Mental Disorders, the DSM-5, categorizes this as a single disorder that includes disorders that were previously considered separate, such as autism, Asperger's syndrome, childhood disintegrative disorder, and pervasive development disorder, not otherwise specified. The causes for ASD are still unknown, and some speculate it can be linked to genetics. There seems to be several different genes that appear to be involved in autism spectrum disorder. In some children, autism spectrum disorder can be associated with a genetic disorder such as Rett syndrome or Fragile X syndrome. Some say environmental factors can be linked. Researchers are currently exploring whether some factors, such as viral infections, complications during pregnancy, or air pollutants, play a role in triggering autism spectrum disorder. While some still believe that childhood vaccines, such as the measles, mumps, rubella vaccine, have something to do with this disorder, yet the vaccine link over time has been shown to be less of a reliable or a feasible association. When dealing with symptoms, the number of children diagnosed with autism spectrum disorder is rising, yet it is unclear whether this is due to more education on the disorder, which has led to earlier detection, or an overall increase in the disorder altogether. Detection can take place as early as infancy, but generally between the ages of 2 or 3 is when the disorder begins to be more visible to parents and clinicians. When the child becomes a little older, it is more evident when they begin to communicate and exude other behaviors. Children with ASD show signs of lack of communication or none at all, withdrawn from socialization of others, and uninterest of what's going on around them. Overall behavior becomes an issue. They may become more defiant and frustrated easily because of the lack of ability to communicate their wants and needs. Each child who has ASD has a different level of severity of the disorder. Some may show small signs and are considered high functioning, and others exude more prevalent signs ranging from moderate to severe, which classify them as lower functioning. When it comes to communication and interaction, some symptoms can be the child failing to respond to his or her own name, seeming unfamiliar with the name being called, delayed speech or inability to say words, lacks the ability to make or continue eye contact, repetitive behavior, such as rocking using same words over and over, hand flapping, unable to feel comfortable with affection such as hugs or cuddling, prefers to be on their own. When in group settings, they can be withdrawn or even aggressive. They also show patterns of behavior, moving constantly. They may be more sensitive to light, sound, and touch, and they may not engage in make-believe or play. They may become fixated on an object or activity, and they may actually also have odd food preferences, such as only eating few foods or eating foods with a certain texture. Treatments for ASD can be discussing these concerns with your doctor would be the first step to rule out any other disorders. Your doctor may recommend developmental tests to identify if your child has delays in cognitive, language, or social skills. No cure currently exists for autism spectrum disorder, yet the goal is to try to maximize the functioning of the child and reduce some of the symptoms of the disorder. Therapies such as behavioral and communication can be a helping tool with language, social, and difficulties with behavior. Showing the child how to behave and communicate around others gives them the tool for social settings. Structure is the key word when it comes to working with a child with ASD. They need the repetitive and structured environment to excel in the program. There's family therapy. Getting the entire family involved with the process can help and allow everyone to participate in the treatment process. There are no special drugs for ASD, and medications are last on the list for treatment alternatives. But some medications can help with some symptoms, such as depression, hyperactivity, or anxiety. There is no way to prevent autism, but the key is to be aware and proactive, and if the signs begin to appear, act fast. Early intervention is the best way to tackle this disorder. The parents with children of ASD are not alone and are encouraged to seek out other families going through the same thing. Thank you.